Hello and welcome to this presentation for the PTSD Resolution Network Conference 2013 on Outcomes of Therapy. My name is Bill Andrews from the Pragmatic Research Network, and I'm also a part of the International Centre for Clinical Excellence. First of all, recently we've just received notice of publication of a 5-year evaluation of human givens therapy using a practice research network, and on the PDF of this presentation in the notes section there's links to the abstract for this paper and also the pre-publication version of the paper. Looking back actually from 2 years ago with the information we have about progress in treatment for clients within our network who have experienced psychological trauma, you can see that recording on a whole host of different measures all show significant gains in treatment and also show very large effect sizes. An effect size greater than 1 is a large effect size, and depending on which measure was used here, you can see all of them are greater than 1.7. We hope to continue our work on analysis of the data regarding psychological trauma within the Practice Research Network and write it up for publication in the near future. But for today, we're focusing attention on the results from within PTSD Resolution on the treatment of veterans of trauma. And these results are covering a period of investigation from October 2010 to the present. And this is an independent report prepared by myself on data supplied to me from PTSD Resolution. So this data is concerning 150 cases that were assessed since October 2010. And the measures that were used were both Core 10, which is a generic 10-question measure of psychological distress, and the Impact of Events Extended Scale, which is a 23-question measure dedicated particularly to the evaluation of psychological trauma. So both measures were used simultaneously at every appointment with the clients. There were 4 females and 146 males in this particular cohort. And the mean age was 43, with a range in age between 23 and 85 years old. And the mean number of treatment sessions was somewhere between 5 and 6. Now it's interesting to actually look at the spread and the range of the number of treatment sessions, and you'll see here on this chart that actually the vast majority of treatments were falling at 6 or less, with very few clients in fact going on to have more than 6 appointments and just a few in excess of 12 appointments. Now, the number of cases, these 150 cases, were treated actually by 51 different practitioners. And it's interesting that when you look at the number of therapists relative to the number of cases, 51 therapists saw 151 cases, but the majority of therapists then saw 4 or less. And in fact, 17 of these therapists actually saw only 1 case. And there were just 6 therapists that saw 6 or more cases. And for me, what's interesting about this is that these results are quite uniform across a wide range of practitioners, 51 different practitioners working with basically the same, if you like, protocol in approach to treatment of psychological distress. And when we just take a broad brush look at the measures that were used here, you can see on this slide that the Core 10, for example, the mean changes in scores in Core 10 go from 23 down to 10.4, and the mean changes in scores on the IESE go from 54 down to 24. So large movements in the scores. Now this, as we look at what's called an effect size, and basically the idea of an effect size is to talk to you about the sort of magnitude of the change, the degree of the effect. In other words, the greater the movement from pre-treatment score to post-treatment score, the larger the effect. And as we look overall in the aggregate at this data, we can see that the effect sizes indeed are very, very large, 1.81 on the IESE and 1.51 on the core. One would naturally always expect the effect size of a generic instrument like core to be a bit less than a disorder-specific instrument, particularly because in this case what is being treated is psychological distress. However, having an effect size that's greater than 1 is certainly a very large effect. And so you can see here that these both are effect sizes way larger than 1. Now, when we think about the levels of distress at the start of the treatment, well, thinking about core 10 first of all, the average intake score was 23. Now, the maximum one could be on core is 40, and the clinical cutoff for core is 11. So any scores of 11 or greater are regarded as being in the clinical domain. But in typical primary care, for example, say clients being referred by their GP for anxiety and depression, we would expect to see typical average scores of between 18 and 19. So an average score of 23 is indeed in a very high level of distress. Now, of the 111 cases where there was a pre-treatment core 10 measure available, 107 of that 111 were indeed above the clinical cutoff of that score of 11 that I mentioned. So what that is suggesting that the clients who are contacting PTSD Resolution wanting to have treatment are indeed scoring very, very clinically. As I say, 107 out of 111 cases. Now, the average impact of events extended score for clients at intake is 54. And there's general agreement that a score of 50 or above on this 23 question measure is indicative, generally speaking, of post-traumatic stress disorder or a very high level of stress in relation to psychological trauma. And of the 131 cases with a valid impact of events extended pre-treatment score, 86 in fact of these cases were scoring above 50. That's 66% of the cohort, and in fact 82% were scoring at above 40. That's 108 of 131 cases. So this is again corroborating the findings from the core 10 that these clients are suffering a very high level of distress. So okay, as we move on to consider the effect of treatment, well, first of all, let's look at core 10. So 111, as I said before, of the 107 of the 111 cases were above the cutoff of 11. Now, 105 of those 107 cases had a post-treatment measure, and this is very, very high quality data collection. That's 98% of the 107 cases had a time 2 measure available, a post-treatment measure or a second measure if you like, which means that we are able to confidently assess the degree of change in treatment. Now, 87 of those 105 cases, which represents 83%, had an improvement in their scores of 6 points or more. So these can be deemed to have improved reliably. So there's this idea of reliable change, meaning when there's a degree of magnitude of change in the score from pre-treatment to post-treatment that's of significantly high enough level to indicate that the treatment has in fact had an impact, rather than sort of random change that might happen with a couple of points. So 6 points indicates that, and 83% of these clients made that amount of gain in treatment.